Well, hyperbaric oxygen therapy is gaining attention for its potential to support healing and recovery for a variety of conditions. In this segment, sponsored by Harch, Hyperbarics Incorporated, we are joined by Dr. Paul G. Harch to share how it works and who may benefit from this technology. Good morning.
Good morning.
Well, thank you so much for being here. For those who maybe didn't see our last segment, tell us what Hyperbarics is, how you got into it.
I got into it accidentally. Joined it. Seriously, got offered a job, if you will, but joined an emergency medicine group here in New Orleans that had the diving medicine practice, treating all of the divers, Gulf of Mexico, South Central United States, and we made a discovery treating them and found that we could treat their brain injury long after the U.S. Navy told us that it was treatable, which means more than 24 hours.
When was that discovery made? Like
1989.
All right,
37 years ago.
Wow, so you've been using this technology for decades now.
Yes.
And watching as it's grown and changed. There are some FDA-approved uses for hyperbarics. Tell me what those are.
There's 13 of them.
But the more common ones.
Well, let's see, the most common ones people don't know, air embolism, but diving disease, decompression sickness, carbon monoxide poisoning, chronic bone infections, bad other types of infections like the flesh-eating bacteria, gas gangrene, plastic surgery complications, burns, diabetic foot wounds, radiation injury, and a few others.
Yeah, and my understanding is that those things were known, back in the 80s, that these things were helpful, and that's why the FDA approved them back then?
Kind of. Chambers came into the United States in 1960, and by 1978, the FDA said, wait a minute, we've got all these chambers, what are they good for? Went to a group of hyperbaric doctors and said, what do you treat? They gave them that list, and the FDA kind of stamped it and said, okay, chamber manufacturers can advertise for this now. And that's the way it came about.
Gotcha.
But in fact, once any device or drug is approved by the FDA for anything, any doctor can use it in their practice how they want. And so there now is a large list of other indications that doctors have used this for. Some of them have much more evidence than the approved FDA uses.
Tell me about some of that evidence. Tell me about some of the not yet FDA approved uses for this technology.
Traumatic brain injury. All phases, all severities, but acute concussion. There's now a very large experience, only some of it published, but for chronic traumatic brain injury, people who have residual symptoms after they've had a concussion. There have now been multiple studies shown that hyperbaric oxygen is effective in relieving these symptoms.
And I think one thing that stands out to me when you talk about using hyperbaric oxygen therapy is that it can be used weeks, years even after an initial problem happens.
Exactly. In fact, many of the uses, it's kind of half and half, are for chronic conditions, and the other half are for acute or emergent conditions. And the studies I'm talking about in post-concussion syndrome, persistent post-concussion syndrome lasting 6 months or longer. Our study, for instance, the randomized trial we did, we were 4.4 years after the event or injury to the patient. So yes, long afterwards, you can still have an effect on these injuries.
That is really cool. If somebody, has a loved one who has a traumatic brain injury or any of the other, approved uses that you said, how can they get in touch with you or find out more and see if this technology could help them?
The simplest way is HBOT.com. You don't have to memorize a phone number or anything.
Just go to HBOT.com. That's where you can find out all the information. Dr. Harch, you are here, you are local, and so folks can come see your practice, come find out more information right here at home.
Yes.
All right, thank you so much.